So for those who are in the virtual audience, thank you for joining our Black Maternal Health Crisis Series, co-hosted by Northwestern Center for Health Equity Transformation and the DuSable Museum of African American History, in collaboration with the Congressional Caucus on Black Women and Girls. So I am Cassandra C, they, them pronouns, clinical research project manager with the Center for Health Equity Transformation here at the Feinberg School of Medicine at Northwestern University. In the second installment of this two-part series, we are discussing the relationship between public policy and maternal health, as well as the actionable steps that we can take to advocate for better policies that improve Black maternal health care. But before we begin, I'd like to bring Perry Ermer, president of the DuSable Museum, to the virtual stage to say a few words to kick us off.
Thank you so much, Cassandra, and it is such an honor to be here with all of you this evening, some of my heroes and sheroes and my wonderful staff and our partners at Northwestern. This is just not only such a critical topic for us as women, but as Black women, and obviously a cause that Congresswoman Kelly and Underwood have been donating a lot of time to, spending a lot of time talking about these policy issues. Just amazed and happy to have you all here this evening. For those of you who aren't familiar with the DuSable Museum of African American History, we are the nation's oldest independent Black museum. And we are celebrating our 60th anniversary this year. And despite a year of pandemic and protest, we are getting ready to reopen our doors on Juneteenth. And I know all of you are aware of the significance of that date. So again, it's an honor and a pleasure to be part of this discussion tonight and welcoming this partnership with Northwestern and with the Congressional Caucus. So with that, I'm going to turn it back to our team at Northwestern.
Thank you, Perry. And now to introduce the moderator for our event this evening, Candace Moore.
Good evening, everyone. I'm Candace Moore. I'm the Chief Equity Officer from the Office of Equity and Racial Justice here in the Office of Mayor Lori Lightfoot. And I have the great honor of moderating today's panel on bridging the gaps in health policy. We're really joined by an amazing group of public policy and health experts. So without further ado, I'm gonna do a round of introductions. First is Congresswoman Robin Kelly. She serves at the Illinois 2nd Congressional District. And she is co-chair of the Congressional Caucus on Black Women and Girls. We also have Congresswoman Lauren Underwood with Illinois' 14th Congressional District, and she also serves as the co-chair of the Black Maternal Health Caucus. We're also pleased to have Dr. Ann Borders. She serves as the Executive Director and Obstetric Lead of the Illinois Perinatal Quality Collaborative. And last but certainly not least, Shaquan Dupart, Doula and founder of the Chicago Black Doula Alliance. So grateful to be here with these powerful women and so excited for the conversation that we're about to have. So if everyone is okay, I'm just gonna dive right in and get the questions going. And I'm gonna turn the first one to Congresswoman Kelly. During Black Maternal Health Week, the US Department of Health and Human Services announced that Illinois will be the first state in the nation to expand Medicaid coverage for mothers from 60 days to an entire year after delivery. Can you tell us why this policy change is so important?
Well, last February, my colleagues and I in the Illinois delegation wrote to the Centers for Medicaid and Medicare Services to support the state's waiver to expand access to care for new moms for the entire postpartum period of 12 months. And we were thrilled to do it. Any OBGYNs you speak to, they talk about how important it is because what happens to moms doesn't just happen in the first 60 days, it can happen the whole entire postpartum period, which is a year. And 70% of new moms have one complication sometime during that year. So I think a couple of weeks ago, Congresswoman Underwood and myself and HHS Secretary Becerra, we were all together when he signed the piece to allow Illinois to be the first state in the union to do that. So very important in saving lives.
Awesome, thank you. And I'm going to take a second to talk about something that happened here in Illinois. So in the last couple of weeks, Governor J.B. Pritzker signed into law a bill proposed by the Illinois Legislative Black Caucus that requires Medicaid to cover doula services for pregnant women. It allows workers to use sick days for caregiving responsibilities and requires implicit bias training for healthcare professionals. Shaquan, can you talk to us a little bit about what is the role of a doula and how do you envision this legislation and how it can help Black pregnant and parenting people? Is Shaquan there?
Yes, I'm sorry. I thought I was unmuted because I definitely clicked the button, but it didn't.
No worries, we got you now.
Okay. So doulas are a educational resource. They're a physical support, and they are, they're there to support families educational wise, physically and emotionally during that entire process. And just equipping them with the necessary knowledge and resources to help the family feel confident and advocating for themselves when they go inside of that medical system. So just being there to support them and guide them and offer whatever resources that we have and just helping them feel confident in going into that setting, because we know that it's already a tense relationship. So going in and not feeling prepared can really hinder the relationship between that person and their provider. So just helping them feel more prepared going into that setting.
Awesome. And I want to invite Dr. Borders. Can you talk to us a little bit about the opportunities for the Illinois Perinatal Quality Collaborative to support the state of Illinois in making sure that patients can utilize the benefits of the postpartum Medicaid extension and improve postpartum safety?
Absolutely. And we're really thrilled with both the extension of the Medicaid waiver, the new legislation around doulas involvement. All of this is going to be incredibly beneficial and directly affect the issues that are really harming women most. And we know that we have to take these legislative steps. One thing that's important, though, is the legislation is the first piece of the puzzle, and then we have to figure out how to implement strategies that are going to really make this legislation work for patients. And so that's where we all have to dig in together. And the Perinatal Quality Collaborative, we are getting ready to launch a birth equity initiative. One of the things that we have focused on in the collaborative, and we work with about 100 birthing hospitals across the state, providers, patients, stakeholders, is one focus we've had and we're going to continue to have is around postpartum safety. And I think the recent Maternal Mortality Review Committee report that the Department of Public Health released showed that of the 1 in 3 maternal deaths happen 2 months and longer out postpartum. So exactly what Congresswoman Kelly was just talking about. So when we think about postpartum safety, ILPQC is going to be working to help hospitals improve patients getting standardized education about maternal warning signs, getting early postpartum visits so we can start women linked into care. But then also we need to be thinking about how do we make sure women know that they have expanded Medicaid coverage? How do we help providers and hospitals know that those women have expanded Medicaid coverage? And I think by getting women in for early maternal visits and really expanding what we do in that postpartum period, we can help then link women to the kind of referrals they need for chronic medical conditions, for mental health conditions, substance use disorder, so they can really utilize that Medicaid dollars during that full year postpartum. So it's going to take a lot of folks thinking about what postpartum safety really means and how do we extend that from immediately when a woman goes home all the way until a year postpartum. And certainly doulas will continue to be an important part of that, not just prenatal care and during labor and delivery, but I think we'll also be thinking about how we continue to engage doulas in innovative ways, even that postpartum period, because again, they're a really important part of this as well.
Yeah, absolutely. And I want to invite Congressman Underwood into the conversation. You have this unique experience of having previous experience as a registered nurse. And the question is kind of how does that inform your policy priorities around reproductive health?
Well, thanks, Candace, for that question. You know,
I bring my full self to my work every day. And so, you know, as a nurse, was certainly familiar with the disparity, learned about it in school, but it was more of like, there's just something about Black women. And we know, in fact, that there's nothing, in fact, wrong with the woman, that it's a healthcare system that has the foundation of racism, and that, you know, we're not heard and we're not listened to, and that there are some systemic things happening that as a result has caused us to die for decades at disproportionate rates. So that's really how I approach this issue, is taking this clinical background, recognizing that as the youngest Black woman in the Congress, it's my responsibility to kind of speak up about these issues that have been, you know, plaguing people like me for ever, it seems like, and certainly taking advantage of the opportunity to work with colleagues on both sides of the aisle to get things done. And I'm really proud of the progress that we've made to be able to, you know, this year, I don't know if Congresswoman Kelly is going to talk about the postpartum Medicaid expansion, not just for Illinois, but nationwide, is a huge advancement. And, you know, obviously our work with the Mommy Bus is going to be very exciting as well.
Yeah, absolutely. And I think we're going to get into some of that conversation here in just a second. I want to take a quick minute to talk about the COVID-19 pandemic. I think about, you know, just what I've experienced from my perch here at the city, and just seeing how it has worsened racial disparities all across the board, but certainly in maternal health outcomes. And the ways in which COVID-19 has really shined a light on anti-Black racism. In many ways, I talk about it, COVID pandemic sort of fell right into the fault lines of racism that already existed in our society. And so Shaquan, if you could share a little bit, how did you, from your perspective, how did you see these issues affect both your work as a doula and your own family over the last year?
Of course. So the pandemic made what was already a strained relationship even more tense. So I'll use myself for an example. So I was pregnant at the onset of the pandemic, and I gave birth in the midst of the pandemic. And so initially having to go to those appointments alone and just digest whatever situations that arose in the midst of the appointment, just having to deal with all of that by myself without the support of a partner, it was a lot for me. And so that, coupled with the insensitivity of some of the providers, that kind of solidified, because I was like teeter-tottering between having a home birth and giving birth in a hospital setting. And so just my experience in the midst of the pandemic, it kind of solidified my decision to go ahead and have a home birth. And that's been my experience since the pandemic began. I've had several Black families reach out to me looking for the support in finding a home birth midwife, because they just didn't feel confident in going into the medical setting, especially during the pandemic, and trusting that they had their best interests at heart. So that's been my experience personally as a doula and as someone who gave birth during the pandemic. That's been my experience in both of those roles.
Yeah, thank you for sharing. I mean, it's so important to think about as we're doing this policy work, the individual stories, the individual cases, and really to keep that front and center in our work. I know in my position as a chief equity officer, I'm often holding the question of, so what do we do about it? What does it mean to build equity around these issues? You know, how do we take stock of the individual cases, but then name and frame what we can do in terms of strategies of our institutions, our policies, and our practices? And so, Dr. Borders, I want to ask you a question. I know you do a lot of work thinking about birth equity at the Illinois Perinatal Quality Collaborative and in different strategies there. Can you share some of the work that you all are doing thinking about this?
Yeah, we are really focused on this. I think we've been, you know, we think about equity and we think about how do we improve the care for all patients, and particularly think about where we identify disparities, how do we do better? And we've done that for a long time, but this year we're launching a specific, you know, naming birth equity initiative that we really see as a foundational initiative. that really talks about how do you create systems change and culture change with birthing hospitals, listening to Shaquan's story, with providers, with nurses, and how do you engage patients and community in that quality improvement work, right? So that's a really big, important part of this. How do you get patients' voices and community members to really think with these groups as we try to move this work forward? So we are moving this birth equity initiative forward with birthing hospitals, launching it. We'll have the kickoff at the end of May, and then really starting monthly webinars and individual work with hospitals and providers and nurses through the summer. So we have about 100 birthing hospitals we'll invite to join. And we do this in partnership with a lot of stakeholders, including the Department of Public Health and others. We will be focusing on some key strategies. And really the focus is to have actionable strategies that hospitals can put in place that can improve equity and address disparities that we see. And so really thinking about what can hospitals do and providers and nurses. So there's 6 key strategies. The first is implementing universal social determinants of health screening. We know that social determinants of health is a huge issue, and for too long, we see someone as their medical condition, and we take care of them as a medical condition rather than as a whole patient, as a whole person. And I think that matters a lot. And I think that we really need to know who someone is when we're trying to improve their medical care and we're trying to improve their pregnancy outcomes. And so social determinants of health screening allows us to understand the kind of stressors and hardships that women are experiencing at home that may impact their health and their pregnancy outcomes, impact their access to care, and then linking women to needed resources and services. So really working with hospitals to figure out how to put universal screening in place for all patients, not just looking at someone and think, I think we should screen them, but really, how do we screen everyone? And then how do we link women appropriately to resources and services in real ways where they have real follow-up? We really think about how to improve our patients' important issues and not just give someone a blood pressure medicine, but really figure out what do they need to be the healthiest they can. Other strategies include using our maternal health quality data stratified by race, ethnicity, and Medicaid status. So you may think, for example, that your data on severe maternal morbidity looks pretty good at your hospital, but until you stratify it and look at it by race, ethnicity, and by Medicaid status, you don't really understand if you have disparities that are happening at your hospital and potential opportunities for improvement right there at your hospital. And so really working with hospitals to figure out how to use race and ethnicity data. And this is something hospitals haven't done at the local level. We certainly do this at the state level, but we're really working to figure out how to do this at the local hospital so everyone can look at their quality data, because that's how we start to make improvements. And it opens eyes. It helps us understand where we need to direct our focus. We're going to be really working hard on engaging patients and community members. We're partnering with EverThrive to do this around the state. We're going to be doing a series of kind of regional trainings and workshops, working with hospitals, figuring out who the local community folks are in terms of maternal child health, and how do we bring patients' voices and patients into the QI work. So that's going to be a big push. And then we're going to be focusing on respectful care practices. How do we engage patients on what expected respectful care practices are? I think providers and nurses all think that we're providing respectful care. I was in the middle of a situation the other day on call, taking care of a really sick pregnant patient. And I noticed that, how important it was that we were taking care of her as a person. And she was really having a hard time, but finding out about her daughter and her daughter's name and who her daughter was named after in the midst of all this gave her this feeling of, we're in this with her. And I think that it's really identifying what respectful care means and what it means for patients. We've been doing focus groups with patients about what respectful care means for them, so that we're not just having an idea of what that means, but really thinking of in real practical purposes what it means for patients. So we'll be giving that kind of information to providers and nurses and to patients about what they can expect, and then doing a survey when patients leave the hospital to find out, did they experience respectful care? And then finally, we're going to be doing a focus on postpartum safety, like I mentioned before. So really standardizing postpartum patient education and improving patients knowing who they are to call when they experience those warning signs, improving early postpartum follow-up, and then that transition to postpartum care while women care. And then finally, a focus on implicit bias training. And I think, you know, folks are thinking a lot about implicit bias training, respectful care training. If you do it by itself, it may not be as meaningful as when you wrap it into a full initiative where you're thinking about systems change and culture change and really focusing on these issues together. And then hopefully we think that by adding implicit bias training into that kind of initiative, we can start to make a difference. So our goal is to work with all the birthing hospitals in Illinois, and it's going to be a big push. So that'll be our focus coming up over the next few years here in Illinois.
Oh, that's awesome. And I just really want to kind of double tap on what you just said there at the end. I think it's so important when thinking about equity strategies. This is not one and done work at all. I love how you are talking about such a comprehensive approach, data, community, assessing, reflecting, thinking about culture, thinking about practices, you know, observing your process, learning from that. This is just so critical in the work. If we're going to have the kind of transformative change that really connects to experiences like Shaquan lifted up. And so
absolutely. And we want to say we need this comprehensive approach, but we also want people to know that we can start this journey one step at a time. And so no one needs to feel overwhelmed by there's so much to do, we can't possibly start. I think it's about understanding the components we need to work on over time and then just get started and work to support each other. So hopefully that's what we'll be able to do.
Yeah, absolutely. And I'm sure folks, as you're listening to this, you have questions, you have thoughts. I want to make sure I'm encouraging everyone. If you have questions, put it in the chat. There's a Q&A function. You know, we definitely want to make some time here at the end for your questions. But I'm actually going to come back to Congresswoman Underwood. You had mentioned earlier about this Momnibus Act. And so could you tell us about the Black Maternal Health Momnibus Act that you introduced and what it entails?
Sure. The Black Maternal Health Momnibus Act is a comprehensive suite of legislation to end our nation's maternal mortality crisis. It's 12 bills. So we have legislation in there to deal with the social determinants of health, housing and transportation and nutrition. We have 2 bills related to COVID-19 because the data has shown us that COVID and pregnancy can be pretty dangerous for some birthing people in our country, particularly Black and Hispanic women who are more likely to get severe COVID illness and then more likely to have negative birth outcomes. We have a bill to grow and diversify the perinatal workforce, bills related to data collection and telehealth to help our incarcerated moms. We have a bill related to substance use and behavioral health and mental health and suicide prevention, which are the leading causes of death, maternal death in Illinois. And so it's so important that we have a comprehensive solution to address at the federal level. We have resources, grant dollars in the Momnibus to support the community-based groups that have been leading on this issue in the absence of federal action. And so I'm so excited. Today has been a huge day. Our first Momnibus bill, the Protecting Moms Who Serve Act, passed the House unanimously. It came as a great surprise to me. I am so pumped. And so now it goes over to the Senate. And we're also very excited because the president has a new bill that he's been talking about, the American Families Plan. And there's some room in there for us to put some of the Momnibus into that package as well. And so we're working hard to identify what can go, through whatever legislative process we can. But there's going to be some action on the Momnibus this year if folks, can continue to help us, right, advocate for its passage. So it's HR 959, a comprehensive, data-driven, evidence-based solution to solve our nation's maternal mortality crisis.
That's amazing, and congratulations. I look forward to continuing to see how the progress here, but thank you for your leadership on that, because I think this is such an important topic. Even as we're talking now, I'm thinking about how this relates to my own life and conversations that I've had with my family about we got new babies in the family, and so there's this generational thing too of some of our grandmothers and aunts having conversations with new moms about what they've experienced. This next topic actually makes me think a lot about this, thinking about breastfeeding in particular and formula. I just think about even some of the own personal conversations we've had in our family as people have learned more, as generations have evolved around this. I'm learning that there's this phrase here, breast is best when it comes to milk for babies. But there are significant racial disparities in breastfeeding initiation and duration. Shaquan, I'm wondering if you can talk a little bit more about this. What factors do you think influence these disparities, and what can be done to increase breastfeeding rates?
So I think that one of the major misconceptions that impact the initiation and continued breastfeeding rates of Black folks is that Black women simply don't breastfeed. So if that is the mindset going into it, then the some of the really important things that need to be done immediately after giving birth, such as doing at least an hour of uninterrupted skin to skin, and having a lactation professional visit the room or at some point during the stay, just to make sure that everything is going well, there's no discomfort, different things that really have a huge impact in whether or not that person continues breastfeeding. Just making sure that those things are in place and that support system is there. That's not always the case. It doesn't happen consistently across the board. Me being one of those people who was impacted by that thought process when I gave birth to my first child. So just having those preconceived notions of what someone is or is not going to do simply based off of their race alone. So eliminating those preconceived notions and providing just a decent level of care across the board would be really impactful in helping someone start breastfeeding and continuing to breastfeed.
Thank you, Shaquan. And Dr. Borders, you're connected to a breastfeeding peer counseling program model. Can you tell us a little bit more about that and how it could promote health equity in the clinical settings?
Yeah, absolutely. So I think Shaquan got, hit the nail on the head. Like, women need support. They don't need preconceived judgment about what they want to do. They need education and support and figuring out what their breastfeeding goals are, and then support to get that done. And unfortunately, for many of our patients, they don't have that kind of support. They don't have access to breastfeeding education and counseling, and then they don't have support kind of across the timeline, prenatally, during their delivery admission, and then postpartum when they go home. And one thing that breastfeeding peer counselors do, so peer counselors are just lay health workers. So it's another model of lay health workers similar to doulas. And these kind of lay health worker models are used so much more in other countries. And I think the more we can think about diversifying our healthcare workforce to give women the kind of care and support they need, the better we're going to be. And breastfeeding peer counselors are women who've breastfed, and then they go through a training course to provide breastfeeding support. They are oftentimes typically come from the community where they're being hired to work as a peer. And they provide education and counseling, like in the prenatal care setting. Then they may come in during the delivery admission and help moms with that first feed. They may be then up on the postpartum floor checking in on challenges women are having and giving them support. I know one breastfeeding peer counselor handed out cards that would say breastfeeding coach. And that's really what they're seeing. Their goal is to build relationships with women in ways that, lactation counselors and nurses do a great job of providing breastfeeding support, and they're incredibly important. And we need all the nurses who can do that and all the lactation counselors we can. But breastfeeding peer counselors are really extenders of that work, and they really focus on vulnerable communities. So women, Medicaid patients from more low-income communities, they can focus on women who need additional help. They can focus in women who have babies in the NICU. So they provide more of a focus to patients who may need additional help and support. They build those relationships over time, and they really help women reach their breastfeeding goals. One of the other things that's important about breastfeeding peer counselors is that they have been shown to reduce disparities and improve breastfeeding outcomes and women achieving their breastfeeding goals I know when we did a recent paper that we are publishing, we increased breastfeeding duration. So women coming back and breastfeeding at their 6-week postpartum visit from around 29% to like 65% for women coming back to our Medicaid clinic. And the largest percent increase was for Black women and Latinx women. So we definitely saw that that's where we had the biggest improvement, and that's been shown in other studies as well. So I think it's a really opportunity where you have a strategy that actually addresses disparities, and it's something that women really appreciate, which is just additional support.
Absolutely, thank you. And I want to, as we continue this conversation, again, just reminding folks, if you have questions, if you have things you want to shout out, put it in the chat. I was taking a peek at the chat. I saw a lot of kudos to Congresswoman Underwood for the Momnibus Act. Congresswoman, I know you also have another effort that you wanted to share with us, this Black Maternal Health Caucus that you launched with Congresswoman Alma Adams a couple of years ago. Could you take a couple of minutes to share that with us as well?
Sure. The Black Maternal Health Caucus is a bipartisan caucus in the Congress committed to ending our nation's maternal mortality crisis. And so it's bipartisan in membership, and we really have kind of a take or leave it approach, right? Membership, you don't have to co-sponsor the Omnibus. Some people are interested for one particular reason or another, but they bring a commitment to addressing this issue. We have over 100 members. And so this is, the Omnibus is one of the initiatives of the caucus, but the caucus is involved in many other things. So for example, we have an appropriations process every year, right? To allocate federal resources to different programs and initiatives around the country. One of the things that we're taking on this year is supporting the work of Dr. Borders and all the other perinatal quality collaboratives around the country because of the tremendous resource this kind of data and analytics could bring to helping to solve our nation's maternal mortality crisis, right? And so being able to have a hub, an opportunity to share ideas and resources and to collaborate to solve this problem in a bipartisan way has been incredibly productive. And I think that it lets us chart a path forward that brings people from all regions of the country, right? Different political ideologies, gives them a space to focus on this issue in a really constructive way. I think one of the other issues that we haven't touched on today is that the political realities of the maternal mortality crisis is that, when lawmakers take action, regardless of what their political persuasion is, there's an opportunity to find, not to be crass, but political success, right? And so we're able to kind of meet folks where they are through our caucus and identify opportunities for them to take action on this issue that's important in so many states. And so we're really excited about the growth and the progress that we've made.
Thank you, Congresswoman. And I know, Congresswoman Kelly, you've been working on some legislation at the federal level as well around the maternal mortality crisis in the U.S. Can you share with us about some of your work? Congresswoman Kelly, you're on mute.
You would think I would know by now.
Are you good?
The legislation that President Biden signed into law that provided the stimulus checks included my language from my Helping Moms bill to provide states the opportunity to expand the postpartum coverage, as we talked about earlier, from 60 days to 1 full year from giving birth. And this is, again, so important because 1/3 of all pregnancy-related deaths occur as late as 1 year after delivery. But we will reintroduce the Helping Moms Act because this gave the states an opportunity. It didn't say you had to do it. So the fear is the states that don't have good records as far as maternal mortality or don't want to expand Medicaid won't do it. So we hope to introduce it again this year with a 5% FMAP bump to incentivize states to expand Medicaid postpartum services. So fingers crossed that this will help. I also have the Supporting Best Practices for Healthy Moms Act that's been reintroduced. And this will require Centers for Medicaid and Medicare Services to publish guidance for hospitals, freestanding health birth centers and other maternal care providers on ways to reduce maternal mortality and morbidity under Medicaid and the Children's Health Insurance Program, so CHIP. And then the original of the originals, the Mamas Act, where some of these things came from, and again, expanding the Medicaid period, standardizing data collection, and empowering a designated federal agency to collect the data, and we want it to be the CDC. So as other speakers have said, there'll be uniform data. We have the data that will drive the policy and what more we need to do. And then also enshrining what are the best practices. Why is it that some places have a high rate, some places do not, some hospitals do better than other hospitals? So let's find out what are the best practices that are done in the hospitals that frankly are more successful at delivering babies and moms live. And it establishes a protocol, obstetric protocol. Currently accredited hospitals focus on infant care more so than maternal and postpartum care. So we want to change that. And then the other thing, there's been many studies that show people do better when it's people that look like them that are the provider, or at least understand the reality of their situation. So we want to do more for more culturally competent providers. We think that is extremely important. And then we have the Maternal Health Quality Improvement Act, another piece of bipartisan legislation. It did pass in the House in the 116th Congress, but we had a hard time passing things in the Senate. Hopefully things will change, but it requires HHS to establish rural obstetric networks. It has to do with grant awards, telehealth services, grants to determine best practices, and again, provide racial bias training. So a lot.
Yeah, so just a few things to get done, but all of that work is so powerful, and thank you for your leadership on it. I know you've also been connected to something that's been recently launched with the Congressional Caucus of Black Women and Girls, a report called The State of Black Women and Girls in the 21st Century America, an analysis of challenges and opportunities. Could you take a few minutes to just share with us about this report and the intended outcomes that you all were looking for as you released it?
Sure. The report came a little later than we wanted. It was definitely a labor of love. The Caucus on Black Women and Girls has been around about 5 years. We've traveled the country and held events and town halls and seminars on, from maternal mortality to women in prison, to women in the STEM field, to wealth, to health, to and girls, just many, many different topics. So this report was a collection of our experiences, and also we went to professionals in the field, people that work with Black women and girls, and they talked about education, they talked about wealth, maternal mortality, they talked about financial literacy, the importance of voting, transformational power, empowering Black women and girls. It talked about the criminal justice system. So all those things. And then we have legislation coming out, the Protecting Black Women and Girls Act. And that would be a task force that looks over all of these things and see, what progress are we making, and what programs or legislation that we need to put forward to improve the lives of Black women and girls. And we didn't just focus on, us as victims. We talked about us as sheroes and things that, we have been able to accomplish. Again, those women that contributed, they were legislators and others that have contributed and have made a mark in their field.
Awesome. Thank you for the work that you're doing there. And it's so important to be elevating that conversation, to be lifting up the data, lifting up the narratives and the stories of Black women and girls, and just so grateful for your leadership there. I know, and I see we got questions coming in, we got comments coming in. I definitely want to get to them. But before we do, I want to have a quick opportunity. We have folks who are gathered with us here on the Zoom. We have people tuning in via Facebook right now. And I'm making the assumption that a number of them are connected and to different bodies of work, are curious and thinking about action. What can they do? How can they advocate for better policies that advance maternal health equity for Black women? And so I want to give each of our panelists an opportunity to kind of share your words of wisdom about what could be done. What could our folks who are joining us here today, how could they support this work? How can they advance this work? I'm going to start with Shaquan. Shaquan, do you want to start us off?
So I think that, and I was thinking about it as you were speaking, but I think what it boils down to is just being a decent person. We can do all of the studies and all of the, panels and everything, but I think it just boils down to just being a decent person and providing everyone with the same care that you would like to receive if you were in their shoes. But aside from that, I can appreciate all of the work that was being done because I'm more of I'm more in the trenches. But I can appreciate the work that Congresswoman Kelly and Congresswoman Underwood are doing in uplifting the stories of Black birthing people and just doing the work in that arena so that we can have the experiences that we desire when we enter into a hospital setting. So I know that it takes both parties. So, people in their arena doing the work on their end, and then people like me in my area who are down here getting our hands dirty, supporting folks in just in the midst of whatever journey it is that they're in. But yeah, just treating people with respect is a major key. And yeah.
Thank you, Shaquan.
Mm-hmm.
Dr. Borders, do you want to share with us your advice to folks?
There's so much, but I think people have opportunities to think about how we can continue to diversify our healthcare workforce. I think that's really important, and there are probably people on this call who have those opportunities. And I think that, whether it's figuring out how are we getting more doulas and more doulas of color in the places where patients need them. So how do we build that workforce? How do we pay for that workforce? How do we reimburse them appropriately? How do we get them there? How do we get hospitals to engage doulas as a part of the clinical team? How does that work? How do we get more midwives? Other countries have significant higher rates of midwives taking care of patients. And how do we diversify that service? And then how do we diversify our health teams? How do we get more providers of color, nurses of color coming up through the pipeline? And so I think really diversifying our workforce, both more lay health workers, like I talked about breastfeeding peer counselors. Right now, they're not reimbursed by Medicaid. Luckily, now we're moving to starting to reimburse doulas by Medicaid. We have to figure out the systems of how that's going to work. But I think really thinking about lay health workers, doulas, breastfeeding peer counselors, patient navigators, how do we get them where they need to be? So that's what I would say as a kind of call to action for folks on the call, just thinking about the organizations you're a part of and the folks that you can reach out to, and how do you really diversify that service? And then how do you think about engaging patients and communities in that process?
Thank you so much. And it's so important to think about the networks that you're a part of, the institutions you're a part of, and tapping into your own agency and privilege to help move and advance this conversation. Congresswoman Underwood, what would you like to share?
Well, I would just ask that folks reach out to their representative and our senators and ask them to co-sponsor the Momnibus. It's HR 959. I mean, literally, that's how we get it done. And we are still working through the Illinois delegation to try to get everybody on board. And so there's some important conversations that you can have with your own representatives locally. And I'm really excited. We've had a lot of productive conversations. Black Maternal Health Week was great. This momentum, we've been seeing a lot of just discussion in our local press, national press. And we know that there's been great momentum and leadership in Springfield and in the city of Chicago. We know that, folks are addressing this issue in every setting, but we do need to continue the momentum that, Congresswoman Kelly started and make sure that we can get these other bills signed into law.
Absolutely, thank you. And last but certainly not least, Congresswoman Kelly.
We need to hear your stories. That's the thing. We don't have all of the ideas, and we need to hear what's happening with people on the ground. As Shaquan said, we need her stories, and we need the stories of people who had a difficult time, with their pregnancy. And as my colleague said, we need people to advocate. We can't do it alone. We need Calvary. We need phone calls to be made, and definitely reach out to your representatives on every level of government. I did a hearing with Senator Christina Castro, State Rep Mary Flowers, and State Senator Jackie Collins, because of all of their work. So we are truly, all in this together. So share your stories, share your ideas that you might have, and that helps Lauren and I. Even though Lauren's already a nurse, so she knows her stuff already. I'd never, until I think 5 years ago, even knew that it was such a problem, so everyone doesn't know, but it is getting a lot of attention now. So thank you guys for what you're doing, because you're helping in this fight.
Absolutely, thank you. And thank you all for your leadership on this work at the various levels. I'm sitting in this conversation myself, just absorbing it all, but just so grateful for the ways in which you are showing up every day around this issue. So just thank you. I know we have tons of questions in the hopper here, and so I'm going to pass the mic over to Cassandra to kind of take us through the Q&A portion.
Thank you, Candace, for moderating such a fruitful discussion. I'll go ahead and jump into a couple audience Q&As. The first being for Congresswoman Kelly. Are there lessons you've taken from the White House approach on vaccine rollout that is informing your plan in reaching community members and informing them of the Medicaid expansion?
Wow, good question. I'm also the chair of the Congressional Black Caucus Health Braintrust. So we've done a lot of work since all of this nationally and locally, but of course, when I say locally, it's mostly, in my district, to try to get the word out to people, to try to get experts on about not only vaccines and everything we need to get the word out on. So, I think that Joe Biden and Kamala Harris have definitely hit the ground running, and we're trying to do what we can do to support what they're trying to do. The Congressional Black Caucus, many members just had a GOTV, and it's get out the vaccine or get out the vaccination. I plan on doing something with the approval of the younger folks, getting their vaccines to work nationally and in my district, as far as encouraging parents, to get those vaccines. But we're just all of us are trying to uplift, what they're trying to do or what they're trying to get accomplished.
Thank you. We have another question from the audience member who's in Kansas, who asks, in our community in Kansas, finding a provider of color is highly rare in both metro and non-metro areas, both for physical and mental health. So what type of congressional work or initiatives can be used or championed to increase the opportunity for people of color that enter the medical field and want to really focus on Black maternal health? And I'll start with Congresswoman Underwood for this one.
Yes, so Cassandra, I actually wrote her back in the chat and put links to the bill. So we introduced the Perinatal Workforce Act as part of the Mommy Bus with an explicit idea that we need to grow and diversify our perinatal workforce. So that means everything from OBs to midwives, nurse midwives, lactation consultants, doulas. We believe very firmly that every birthing person should have a choice in the provider that they see. It shouldn't be restricted because of where they live geographically, urban or rural. It shouldn't be limited because of their cultural background or the language they speak, or someone seeking a religious congruence, or whatever. We should have a diverse and robust perinatal workforce so that people feel empowered and can have great birth outcomes. And so this legislation gets to that point. In the QA, if you click on answered, you can get the link to the bill text, and you can get a link to the summary so that everybody knows what to ask for when they reach out to their legislators.
Phenomenal, thank you. And I'll actually follow up with Shaquan and ask for her perspective as someone who's in the trenches. What kind of initiatives can be championed to really support doulas on your end for those who enter non-BIPOC or non-Black spaces to do this work?
So again, I'm going to sound like an echo, but supporting, so there, I know of plenty of people who are interested in becoming midwives, whether it is a certified nurse midwife or any other kind of midwife. But one of the major things that kind of prohibit them from being able to complete that journey is the financing of an education in order to become a midwife. So making that more of a reality, because I myself am in school to become a nurse midwife, and tuition and books and being able to sustain my family and all of that while I am on this journey of trying to become a midwife, it is a lot. And so removing those barriers so that people can go and pursue those roles, so that we are there and able to support people, and so that people can have providers who look like them. And then I had one other thing. I'm sorry, and pregnancy brain has it slipped away. What was the other thing? I can't remember. But yeah, so just removing the barriers so that people are able to go and complete those programs, so that people can have access to providers who look like them, because that is one of the major things that is talked about in the doula community, because many midwives transition from being a doula to going to school to be a midwife. So just making that more of a reality for us would be super helpful. Oh, I'm sorry.
No, I just wanted to tell you, we just had a hearing, and Tatiana Ali, who was on the Fresh Prince, she didn't have a good first pregnancy, but the second one, she had a midwife and she loved it. And then we had something locally about maternal mortality, and then we had a doula on, and it was, I never could think of her real name, but the woman who plays April in Chicago Med is a doula. Yeah,
Oh.
You need to meet her. And
I love Chicago Med.
Me too. And she's a doula, so she spoke for us.
Oh, I did not know that. Thank you for sharing that. Oh, and then whenever whatever else I was going to say, whenever it comes back to me, I'll throw it in somehow.
No, thank you, Shaquan and Congresswoman Kelly. Dr. Borders, are there any groups the Illinois Perinatal Quality Collaborative works with for planning direct work with parents and communities to hear concerns about implementing resources for needs related to the Black maternal health crises?
Absolutely. So we work really closely with EverThrive. They help us in setting up our patient focus groups, in engaging patients. We have patients on all of our advisory work groups. And so if there are patients or family members or community members who want to participate and have a voice, we absolutely want to hear from you. So you can reach us on our website, www.ilpqc.org, or our email is info@ilpqc.org. And we're really interested in patients' voices and community groups participating. We have stakeholder meetings where we bring in community groups. We always have patients speaking at our events. And I will tell you that when we have 500 physicians, nurses, public health folks, patients in a room, it's always the patients stories, the patients getting up and sharing their stories, that brings down the house. That's what motivates people to change. And when we work on culture change, we work on figuring out how to make a difference and get hospitals to change. And I will tell you that nothing is as powerful as patient stories. And those can be stories where patients have had care that was not optimal, and that can be stories of care that was optimal, that was the best care. And so both positive and negative and all everything in between, that's really what motivates. And that's what brings, I think, the passion for folks to really do this work and do it better. So we're very interested.
Great, and I actually do have a follow-up question to that. As we talk about the impact and influence that doulas and midwives do have for Black moms who are birthing, how much influence does the AMA, the American Medical Association, and other medical lobbies have over keeping doulas and midwives at such low numbers?
I don't know that I know the answer to that question if it was directed toward me. Maybe Congressman Underwood or Kelly know more. I know that if you look at other countries and what numbers, like at the obstetric workforce, overall, we have a much smaller obstetric workforce, even if you put obstetricians and midwives together, where we have a much smaller workforce than most of our other peer developed countries. And then we have significantly fewer midwives. And other countries use midwives for prenatal care, delivery care, for low-risk patients, and then also a lot of postpartum care. Midwives are going into patients' homes on a regular basis in other countries and getting lots of postpartum care. So I think that there's a real call for increasing the number of midwives and doulas that we have available. We also have a huge need because we have obstetric, we call them obstetric deserts. So basically areas where it's really hard to get obstetric care. So our rural communities have large regions where they have to drive a long way to get obstetric care. And then the same thing happens even in our urban communities where we'll have a hospital close and we don't have quick access to good and nearby obstetric care. So I think there's a huge opportunity to increase the number of obstetric providers, increase the number of doulas, increase the number of midwives, think about alternate models of care in partnership with current services. And I think it's a lot of working together with those groups to really understand what the benefits are of expanding our workforce, and that it really can be a win-win for everyone.
If I can just, in my experience, particularly ACOG has been very supportive of, and I mean, I've been stunned at how forthcoming and supportive they've been on our efforts to grow and diversify the perinatal workforce.
Yeah.
And in my
Absolutely.
experience, the key drivers in the low numbers that are referenced in the question are twofold. One is that for these professions, in particular, doula and midwives, not necessarily nurse midwives, but to an extent, it is up to that individual to finance their education. So that is very different than the way that physician education is financed in this country. And this is a problem even in nursing education, and particularly as we talk about advanced practice, clinical nursing education, that provider is being asked to finance their education, which is just not sustainable, particularly when we're talking about the need for a diverse workforce in all communities. That is why we have this legislation to be able to support the education and training of these types of providers. The second key factor in my experience has been payment policy. And that is why having these payment models and equity in terms of making sure that Medicare and Medicaid are including these types of providers and allowing them to practice to the full extent of their education and training is very, very, very important, because we do know that private insurance companies often get their cues in terms of payment policy from the federal government, right? So there has been over the years, for example, a big push for equity in terms of midwifery care and making sure that that is covered within these programs. We have, I think, some progress to make with doulas, and we're working on it. But I think that it's less of a maybe conspiracy, if you will, from the physician groups, and much more of a healthcare financing problem.
I completely agree. I think that it's about payment. It's about payment for education, and that's about payment and reimbursement of how we reimbursed services. So 100%. And because we have this two-tiered system in our country, like Congresswoman Underwood is saying, between private and public insurance.
I remember what I was going to say, if we have a moment. So I was going to Congresswoman Underwood touched base on it. So another way that we can make sure or encourage people having access to providers who look like them is to make sure that we're paying a living wage. I know there was like a fiasco somewhere else last year because doulas, there were a lot of stipulations around the reimbursement for doulas. And so not making it more of a hindrance, like approving just a certain group of doulas and so that they're allowed to be reimbursed. So not making it as hard for another group of doulas to be reimbursed. So not putting all those stipulations in place so that we all have access to that reimbursement, and then just making sure that that reimbursement is enough for that person to be able to sustain themselves. So yes, that as well.
Thank you all so much. In the interest of time, I will end the Q&A portion here. There were so many good questions that unfortunately we couldn't get to, but I would like to thank our panelists and the virtual audience members for joining us this evening for the conclusion of our two-part Black Maternal Health Crisis Series discussion. And I hope you were all able to gather lessons and motivation to advocate for the policy changes we need to ensure that we eradicate the Black maternal health crisis and uplift health equity in the process. So finally, please join us this Friday, May 14th from 12 to 1 p.m. Central Standard Time for our center's event titled The Intersectionality of Gender, Race, and Class During COVID-19, the Impact of COVID-19 on Interpersonal Violence. The link for the event will be posted in the chat. So thank you all once again. Thank you to our speakers.